Good evening. Thank you for joining us this evening. My name is Nick Sigleric, and I'm the Superintendent of Northwest Education Services, formerly TBA-ISD, and I will serve as the moderator for this town hall event. I'm sharing the screen today with local health experts and physicians, the people that we look to for help with medical concerns, and the ones that we trust to be knowledgeable and honest when it comes to health issues that impact our lives. One of those issues is obviously COVID-19, and today we'll be discussing important facts about the vaccine, along with clearing up some misinformation many may have encountered. Our healthcare experts will also shed light on new developments in the fight against COVID-19, like the vaccination opportunities now available for children ages 12 and up. As an intermediate school district that covers 5 counties in northern Michigan and serves around 22,000 students, we believe we're uniquely positioned to help facilitate this type of regional discussion. Being an educational institution, we place a very high value on accurate information that is backed by data and research. And that is why we're so very pleased to have our professionals with us this evening. As educators, we also remain committed to student safety, which is a priority for us in and out of the classroom. With those two concepts in mind, accurate information and safety, we have emerged as focal points throughout the pandemic, and we are the driving force behind tonight's event. To start off, we'll be discussing some of the common questions that we've been hearing from our parents and community members around COVID-19 and the availability of vaccines. We also want you to be able to weigh in and ask questions. So to ask a question, you will see a Q&A function at the bottom of your screen in the Zoom window. Please feel free to type your questions in there at any time, and we'll answer as many as we possibly can. Clearly, COVID-19 has changed our lives in many ways, and over the past year, it's created several challenges in education. Some of those challenges have caused school closures and cancellations, the delay of co-curricular activities, and we recognize that it's been an incredible burden on many of our families and students. It really does start with education and learning the truths about the vaccine. And as we said, that's what brings us here this evening, and I'd love to introduce our panelists. First, we have Dr. Josh Meyerson. Dr. Meyerson is currently serving as the medical director for 3 local health departments in northern Michigan. Part of his duties include serving as the medical director of 2 grant-funded school-linked child and adolescent health centers in underserved rural school districts in northern Michigan. Dr. Meyerson earned his Doctor of Medicine and his Master's in Public Health from Tulane University in New Orleans. He completed his residency in pediatrics of the University of New Mexico Children's Hospital and is board certified in pediatrics. Dr. Christine Nefsey. Dr. Nefsey serves as the Chief Medical Officer for Munson Healthcare, where she provides strategic direction for clinical initiatives and strengthening clinical practices across the system. She also oversees system quality and collaborates with executive directors of the service lines. Dr. Nefsey earned her medical degree from the Uniformed Service University of Health Sciences in Bethesda, Maryland, and completed her residency in pediatrics at Uniformed Health Service Education Consortium, Wilford Hall Medical Center in San Antonio, Texas. Dr. Nefsey is a fellow of the Academy of GE Fellows and the Intermountain Healthcare Executive Development Program. Dr. Stephanie Galdis. Dr. Galdis from Kids Creek Children's Clinic is a graduate of Michigan State University College of Orthopedic Medicine and completed her residency in pediatrics at the Children's Hospital in Michigan in Detroit, where she served as chief resident. Dr. Galdis is a board certified pediatrician and a fellow of the American Academy of Pediatrics. She has a special interest in newborns and infant growth and development, but cares for children of all ages. And we also are pleased to welcome Dr. David Klee. Dr. Klee works at Munson Health Practice in Traverse City and in Cadillac, and serves an emergency medicine physician with Munson Cadillac Hospital. He earned his medical degree from the University of Minnesota Medical School and completed his residency at Mid-Michigan Regional Medical Center. A fellow of the American Academy of Family Physicians, Dr. Klee also serves as Associate Program Director of Munson Family Medicine Residency and Associate Professor of Family Medicine at Michigan State University. So as you can see, our panel of experts have a breadth of knowledge and expertise, and we're so very pleased that they were able to join us this evening. I'd like to give our panelists a few minutes just to discuss what they've seen through the pandemic and share some of their experiences, and we'll begin with Dr. Meyerson.
Oh, just to share a few comments. This last year has been really challenging, and it's been challenging for all of us, and the impact to our children certainly has been significant. I'm really proud of what has gone on in our communities and in the schools and the parents and really and the kids too, to really be able to safely hold in-person school for the majority of this school year. But we also have seen that the impact that the disease has had. We have had children who have gotten sick, and even in those, most of them that have mild illness, it's meant a lot of missed days from schools and other activities, the isolation that's required, the quarantine to control this disease. And I really think, we are turning the corner here, and especially with the availability of the vaccine, I can see that we can, offer a much better experience for all of us and our children too, going forward, to be able to more fully engage in the activities that are important for their growth and development.
Thank you, Dr. Meyerson. Dr. Nefsi?
Thank you. This year, I think there aren't words enough to express sort of the stress and degree of work that has needed to be done this year. I think this is probably a once in a lifetime kind of experience for most of us as physicians and providers. Just like anything, there's been a lot of components to it. The level of morbidity and mortality that our providers have seen, the level of stress we've seen on the community is like nothing we've seen before. And at the same time, the response we've seen from the community, the pulling together, the working together, the coordinating, the care and efforts to support not only our patients in the hospital, but our kids, our families, and other members of our community has really been unparalleled. It's been a learning experience. I hope that we are heading towards the end of it. But we still have some work to do. And I can't speak highly enough of my colleagues in healthcare, in education, in our local governments. And again, it's been a year of new things and learning, and I hope one that we can come out of with the experience that we need and never have to use it again.
Thank you, Dr. Nefsi. Dr. Galdas?
Yeah, so this year has been really tough on a lot of us, and it's been really tough on our kids. It's been tough on parents. It's been tough on teachers. And in our office and across the nation, we have seen COVID-19 significantly impact our kids on their physical health and on their mental health and disruption of their education. Over the past year, there's been about 1.5 million adolescents, 12 to 17, that have contracted the virus, and about 13,000 of those kids required hospitalization. And unfortunately, some of them passed away. And so as parents, we try to do everything in our power to protect our kids. And during this pandemic, that's meant mask wearing, hand washing, social distancing, keeping our kids home when they're sick. And it's just exciting that we have this opportunity now to continue to keep our kids safe by vaccination. And so the quickest way for us to get our kids back to their normal life is to be able to vaccinate them. And the ability to vaccinate kind of allows us as parents and medical care providers to have a peace of mind that they're protected from this virus. We know that if we're able to vaccinate this population, that increases our immunity throughout the community and will spread less disease. And that's a really big deal. And so tonight, I just hope we can kind of share this knowledge to parents so they can make educated decisions about how to keep their kids safe. And I appreciate being here. Thanks.
Thank you, Dr. Galdis. Dr. Klee?
Thank you for having me. This year has been like no other. We have gone through a lot as a community, as healthcare professionals, as patients. I've been able to work with patients through the clinic, in the ER, in the hospital, in the ICU that are going through COVID or going through it with their families. Been there with people, talking to them about whether they should go on a ventilator, knowing they had a small chance of survival if they did, and zero if they didn't. But they had, this gentleman had several small children, and so he wanted to do what he could. And so he went on the ventilator. And 3 weeks later, I was with him when he came off the ventilator and survived, which was just a fantastic time to be able to be together. And so we share these stories. We've gone through these, and we've also been with people that haven't survived, and with family members that haven't survived and weren't able to be there with their loved ones because of the COVID. And so it's been a tragedy, and it's been so frustrating when we really didn't have many good things to be able to combat that. But now we do. We have vaccinations that are very effective. We've had excellent studies that show these work really well. The newest studies on the 12 to 15-year-olds show that it was 100% effective in preventing the vaccine versus kids that didn't get the vaccine in the study that were getting COVID. So we have ways to protect our kids. We have ways to help protect our communities. Our kids have lost a lot in what they've missed out on, from time and sporting events to going to prom and graduation parties and just being together as a group, which we know is so important. And we've seen rocketing up mental health issues across the spectrum of ages, but really high in the adolescence. And so this is really a way that we can start to get people back into a more normal and healthy life if we can vaccinate our communities.
Thank you so much. Really appreciate those words and those introductions. And we have some questions that we're going to dive into, but I would just like to say maybe just 2 points as we begin our discussion this evening. Number one, we're going to be focusing on school age issues and questions. Obviously, as educators, we feel our duty and obligation is to serve our community and serve our students and parents. And number two, I'd like our parents to know that the collaboration with our medical community that took place this year has been unlike any other. The physicians touched on it, but I would just like to say from a school's perspective how much I value and appreciate the constant conversations, the directions that we received, and the guidance and advice. And so I appreciate the partnership and want our parents to know that it has been a year-long partnership, and we're going to continue that moving forward. So we'll start with the first question. Will the COVID vaccine be required for students to attend in-person school? And I think I'll kick that one to Dr. Meyerson.
Sure. Well, the short answer is no. COVID vaccines are voluntary, and at this time, they are not required, and there's no plans to make them required for school attendance. In general, school vaccination requirements are set by the state. There's certain vaccines that are required at entry at kindergarten or 7th grade, and there's exemptions, of course, but those are set at the state level. In this and across the country, it's something that is done state to state. So there's no plan right now to make that required. Certainly schools, the providers, the public health, we encourage our students to get vaccinated because it's going to increase, they're going to be more immune. It's going to increase our community immunity. It's going to increase the immunity within that school building. So you're going to have less outbreaks. That's going to allow things like school, classroom, sports, athletics, extracurriculars, all of those things are going to be able to go on much more smoothly with less interruption or disruption than if you don't have a highly immune group setting. So that's something that we certainly want to see. We want to encourage that so that we can have a very safe environment to have school in. I think, and as a sidebar to that, I'll mention mask use as well, because a lot has come out, in the last week about masks and not required to wear masks if you're vaccinated. But right now, what the CDC is recommending is really for the rest of the school year that we just kind of keep things going steady. We're doing well here, and the recommendation is that we should continue all of those mitigation measures that are in place to make schools safe. And that includes masking for students and employees through the rest of the school year.
Thank you for that clarification and reminder. Do I have to pay for my child to receive the vaccination? Dr. Nefsi?
You do not have to pay for your child to receive the vaccination. There are some places that may, if you are insured, charge an administration fee to your insurance. There are some that don't, but you would not have to pay out of pocket, regardless of insurance or not, for this vaccine.
Thank you. How old does my child have to be to receive the COVID vaccine? And when might the vaccine be approved for younger children? Dr. Goldis?
So as of last week, on May 13th, the Pfizer vaccine for COVID-19 was approved for adolescents 12 and up. And the data showed great safety and efficacy for that age group. And so you just have to remember that the same scientific review process that looks at all your other children's vaccines was used on this vaccine as well. And what's even more exciting is that we have ongoing trials right now for kids younger, 6 months and up, I think is what they're studying right now. And hopefully we can see some vaccination of our elementary age kids this fall.
Great, thank you. Will proof of age be needed for children to receive the vaccine? Is parental consent required? Dr. Klee?
Yes, parental consent is required because they're minors. And so you need to send a parent or a guardian with the child to get their vaccine. There are certain counties where you may be able to use a note or a phone call that's verified by a couple people as an alternative. So you can check in with where you're going to get your vaccine to see if that's an alternative. But to be safe, you're best to come with your child so that they can get their vaccine.
Thank you for that. Dr. Meyerson, here's a question. I'm concerned for my child to receive the COVID vaccine because of the development of the vaccine seemed rushed. And we did have a question in the chat that kind of talks a little bit about, the 12 and 13-year-old, and are there any potential downsides for the vaccination with students that young? So if you could address both of those, that would be great.
Sure. Well, that's a really good question, right? I think that's a lot of us thought that. How could they come up with a vaccine so quickly when when ordinarily it takes many years to fully develop and bring a vaccine to market. So, and a year ago I had similar thoughts. So I think it's normal to ask that. But we've learned a lot. I've learned a lot in the last year. And, some things to share is that one of the things, as soon as the genetic code was determined and figured out for this virus, which was January of 2020, so 14 months ago or 15 months ago now, that was shared. The genetic code, the sequence was shared across the world, and scientists could all look at it and start to determine how to design treatments and vaccines against this virus. So the vaccine development really did start immediately. The mRNA vaccines, the Pfizer vaccine that is being used for 12 years and up in mRNA vaccine, that technology has been around for over 10 years. They've looked at utilizing it for a lot of different treatments in addition to vaccines for treatments of other diseases. So that was not a new technology, but immediately people looked at it as being a really good, viable option to quickly develop a safe vaccine that could be quickly developed. And then, when you start making a vaccine, the vaccine trials have to go through several phases, phase 1, 2, 3, to determine safety and dosage and all of those things. And in one sense, it was rushed in that what they could do is they could combine these trials. They actually combined phase 1 and 2 so that they could speed things up along. The phase 3 trial, which is the large trial where they had over 30,000, 40,000 people in these clinical trials, where they gave, half the people got a placebo, half the people got the vaccine. That's the important part of the trial that really looks at large numbers of people to determine that it's safe and that it's effective. And those trials were not rushed at all. They really completed those trials, like they do for any other pharmaceutical product, any other vaccine. It was not rushed. And they had several advantages. How could they do it so quickly was a big thing, is that governments across the world bankrolled this. They said, we will pay for you to do this. We will pay. And we didn't just pay for Pfizer or Moderna. We invested in vaccines from several companies and said, we will take the financial risk from you to develop this vaccine if you go ahead and start things right away. And at the same time as they were doing these phase 3 trials, they were producing vaccine and stockpiling it so that if approval was given, they could immediately be shipped out. And that's what happened. That the vaccine was approved for use on December 15th or 16th, and it was being given and being used the next day. That was because it was the financial investment was made so that they could do that without going bankrupt in the process. Specifically looking at the 12 to 15-year-old age range, the same thing happened. They had to have a phase 3 clinical trial. They had to enroll participants, and they went through that whole process properly so that they could look at it. And Dr. Klee mentioned it, where they gave hundreds of children the vaccine and hundreds of children got a placebo, and they could see that the 12 to 15-year-olds who got the vaccine, none of them got COVID disease, where many of the children who did not get the vaccine did get COVID. So the trials were not rushed, and given the large amount of disease transmission that's been going on, they were able to actually complete these trials relatively quickly because you have to kind of wait around and wait and see if people get sick. And unfortunately, as we all know, we've had lots of viral transmission going on in this country. So I think that the important parts of the clinical trials were done properly and they weren't rushed. But it's amazing. To me, it's incredible, and I'm very thankful that we have the technology and the resources to do this and get this available in really such a great quick time turnaround, and knowing that they're safe and effective.
Excellent. Thank you very much. Dr. Nefsi, there's a myth out there, won't the COVID vaccine give me COVID?
Yeah, thank you. So that is a myth. It will not give you COVID. The way that these vaccines were developed is they have a protein that it mimics the virus and actually forces your immune system to recognize that protein and therefore be able to recognize the actual virus and then fight it off if you are infected. There's no live virus. There's no ability for the vaccine proteins to replicate in your body. So it does not give you COVID-19. Now, when your immune system responds to seeing that protein and starts to build up a defense, you can get symptoms from that or side effects from that. You may have a sore arm, you may have a low-grade fever, you may feel a little bit under the weather, kind of have a headache or achy, that kind of thing. It's important to understand that that's really your immune system working. It's not that you have the virus. It's a common misconception that we've seen with the influenza vaccine as well. But that is not the case. So just to sum it all up, getting the COVID vaccine will not give you COVID.
Excellent, thank you. Dr. Galdis, is natural immunity to COVID better than immunity from a vaccination? And a follow-up, if my child already had COVID, does he or she really need the vaccination?
Yes, so those are great questions. So it is still recommended that if you've had COVID-19 in the past infection, that you still get vaccinated, because we just don't know how long those antibodies last. And so this is ongoing studies to see how long they'll last. We know that, within the first 90 days after an acute COVID-19 infection, it's unlikely to get reinfected. But we do know that you can get reinfected with COVID-19 after that time. Right now they're watching to see how long antibodies last, and there's new data coming out all the time. Just most recently this week, there were some studies that showed that measured antibody levels in vaccinated individuals were 5 times higher compared to individuals with recent COVID-19 infection. So that just shows how effective the vaccine is. And that's important when we're trying to prevent reinfection, and also really important as we see these variants come through. And so it's just, yes, the answer is you should still get vaccinated even if you've had the COVID-19 infection.
Fantastic. And then Dr. Klee, why not wait until school starts in the fall to vaccinate my children? Or why should I consider getting my child vaccinated if the risk of COVID to his or her health is so minimal? Really great questions that, are floating out there.
Yeah, thanks for that question. I think this is an easy one. So if somebody gave me an amazing present and said, you can open it right now, or you can open it in 3 months, that's an easy one. I'm going to open it, and we have this present, it's called the vaccine. And so there's this idea that kids that don't get symptoms, it's really only about 15% of the kids that have COVID that don't have symptoms. About 75% are getting mild to moderate symptoms. And so they're getting sick. There's a small proportion of kids that get really sick, that are getting hospitalized and that are even dying. You can get a process down the road a couple of weeks called multi-system inflammatory syndrome, which kids are getting really, really sick with. And that happens even after you've had COVID. And so you protect yourself, you protect your kids from getting these bad things down the road. I talked with a patient yesterday and that got COVID 10 days ago. She's been out of work for 10 days. She's still sick. She can't go back to work. She said her whole family's sick. Doesn't sound like much fun for the summer for me. I wouldn't want to be stuck inside, quarantined, can't go anywhere when I got a vaccine that can prevent that. Where I work in Kenya, in a small hospital over there, in one weekend, we had 10 kids in our neonatal unit die of measles. We're not used to that in the US. We're not used to these bad viruses that can attack us. And we're protected by these childhood immunizations that people haven't seen the bad effects of some of these viruses in a long time. But we have a new virus that we're not protected from But we know we don't see measles and mumps and German measles, all these issues here anymore because of vaccinations. And so it's really important that we get these vaccinations. We start them now so you can enjoy your summer, so the kids don't miss going to camp or their sleepovers or their time with their friends, and we can get back to a more normal life.
Thank you, Dr. Klee. And you've triggered a reminder for me, and that is, if you are a close contact and you have the vaccine and you're fully vaccinated, you don't have to quarantine. And that's a great incentive, if you will, along with everything else that you said. It's a great reminder so we can get out and be active. So we've got some great questions that are coming, live questions. So I'm going to try to connect them, and then I can just throw it out there, and any one of the experts, please feel free to answer. First question, how do we as parents of kids younger than 12 navigate safely through the summer until a vaccine is available for them? Should they not be doing indoor things without masks? Outside question, should they not be around unvaccinated people indoors without masks? Some great questions there. Who wants to tackle that one?
I'm happy to take that. The good news is the more we've learned about this particular virus is that your risk of getting it outside is relatively low. So I think especially as we had such a beautiful day like today and we head into some warmer weather, I think you can feel pretty safe having your kid participate in outdoor activities. I think the indoor activities is where it gets a little riskier. And I would say it really depends on what the activity is and who they are with. So you will need to make a decision based on where your child is inside, how well ventilated the space is, how much time they're spending in there, and the risk for your child in particular, or family members or other loved ones that would be around him or her. I don't know if anybody has anything to add to that.
The other thing I'd add is hopefully, our cases are declining. We still have a lot of viral transmission out there, but as we can get more people immunized, if our, disease rates go down, then of course the risk to those that aren't vaccinated should also go down. So, what I'm hopeful for is that we'll continue to see a decline in our case rates, that might also be able to inform you when you make those decisions in determining, what's an acceptable risk.
Great, thank you for that. Next question. What about safety of the vaccine during pregnancy, including during different stages of pregnancy? Does anyone want to tackle that one?
I can take that since I do obstetrics. The vaccine is believed to be safe during pregnancy. It's a recommendation to weigh the risk and benefits with our pregnant patients as far as if you were to get COVID, how is that going to be? We know that when you're pregnant, it decreases your immune response, and so you're at a higher risk. We know there is a potential that you can pass it vertically, meaning from mom to baby, but we don't see a lot of that. It is possible. And so trying to protect the moms, the American College of OB-GYN has recommended that we have those discussions, and that it's something that as OB providers in our community, we felt very strongly that we recommend it to our patients.
Great. Here's a follow-up, I think, from an earlier question with regards to the children that are under 12 that can't be vaccinated. And that is the CDC lifting some of the masking restrictions. It feels a little bit reckless using the terminology of this individual asking the question with the youngest population. And so I don't know that that's a specific question, but maybe you could just comment on, and I thought Dr. Nefsey and Dr. Meyerson, you've kind of addressed this from an indoor a community transmission perspective. But any comments on the CDC lifting the requirements and what that might mean for our youngest population?
Yeah, I can start. I think a lot of us were a little surprised at that announcement. Right now it's not consistent with MIOSHA as an example, or even what we're doing at a state level. So I think it's nuanced. So I think that they're right. If you are fully immunized, you are likely very safe to be around others who are either vaccinated or not vaccinated, indoors or outdoors. I think fully vaccinated people certainly are at low risk for contracting. It's not no risk, but it's low risk. Remember, at 95% efficiency, you've got about 1 in 20 who can still get COVID-19 despite being fully vaccinated. So, I think that part is true. I think the hard part is we've only got about half of our population immunized, and we don't know what half that is. And so when you're in, an enclosed space, it's really hard to know. You can go on the honor system, but I think, unfortunately, one of the things we've learned throughout this pandemic is that people have strong feelings about a vaccine, about this pandemic, about a lot of different things. And so not knowing who around you is immunized or not is really the difficult part about that announcement from the CDC. So I would say do what you think is right and safe. I mean, personally, if I was needed to get on a plane, I would probably wear my mask. I don't know who on that plane is vaccinated or not vaccinated. When I go to my friend's house or those kinds of things, I know where they're at. And so I would feel much safer, because I have an understanding of their status. So I would say if you're in a crowded spot indoors that's not well ventilated and your kid is too young to receive the vaccine, if it were my child, I would probably have them masked.
Yeah, and I just want to add, just don't let your guard down. And yes, be aware of where you're going to be and who you're going to be around. And we just don't know who's going to carry the vaccine or carry the virus and who's truly vaccinated or not. So using those social distancing guidelines about where you are, who you're with, and who your unvaccinated kids are with is very important.
Yeah, I think we all are feeling the COVID fatigue, right? We want to be done with this. We wanted to be done a long time ago. And so it's hard as it's getting nice to not just think, let's go all hang out at the beach like we did last year or 2 years ago anyhow. So we wanted back to that. And so it's taking that in measure, being smart about it. Like Dr. Nefsey said, kind of nuancing it, knowing when you can be a little more open and when you need to keep your guard up, like Dr. Galdis said.
Fantastic. The next question in the chat, what are the long-term effects of the vaccine for children? And I guess I'll also add to that I heard that there's, a myth going around fertility or potential fertility implications for children down the road. And if someone could address kind of the long-term effects for the vaccine for children and that, I think that would help our parents out quite a bit.
So I'm happy to start. Dr. Klee, were you going to start?
No, you feel free. You can take that.
So, it's interesting to hear how some of these rumors and myths get started. So to be clear, the long-term effects that we really don't understand or know are actually for the virus itself. What we've known since we've been going through this for the last year and a half or so is that there are actually a fairly significant number of patients who get this virus and do have long-term effects from it. We don't fully understand who and why that is, but we know that that's the case. The way the vaccines work is they don't get injected to you and stay in your body. That's not how they work. They go into your body, they prompt an immune response and then they go away. You know, our cells turn over, depending on which cell line it is, they turn over every so many days. And so viruses don't just go into your body and hang out, or sorry, vaccines don't go in your body and just hang out. You know, your immune response, that memory response, those cells that remember all different kinds of the thousands of bacteria and viruses that we fight off every single day, that memory stays there. But the, you know, the virus, if you get it, doesn't, except for chickenpox, does kind of hang out. But, you know, the vaccine doesn't hang out in your body and then cause long-term effects. So, you know, that's that part. As far as fertility goes, you know, we've done now lots and lots of studies. We've got many women who got pregnant while in the midst of getting the vaccine, who have gotten it while they're pregnant, have gotten coronavirus while they're pregnant. We've actually got some decent studies now, and there's no evidence that this causes fertility issues or anything like that. You know, that rumor that started was based on one scientist who looked at one particular protein out of thousands that could possibly cause some issues. And that has not panned out. It has not ever been shown to be in any way true. So personally, I have no concerns that this vaccine will cause fertility issues, either acutely or long-term.
Yeah, I'll just add on to that, you know, the vaccine, as we know, came upon us in December. And so we haven't had it long enough to have long-term studies. It's only been around for 6 months. But we know that it doesn't incorporate into the DNA like one of the myths early on. And so it's not changing our genetic code. It is producing this immune response. And so when you are exposed to a COVID in the future, you'll have these antibodies that can come up and fight, and that'll help. And so that is the body's normal immune response, just like every other virus. Coronaviruses have been around. They call it common cold. This is just an abnormally mean coronavirus that we're trying to fight off. And so we needed a stronger way of doing that. So the vaccines are here. They've been safe. And as Dr. Nefsey pointed out, the downside that we have been seeing over the last year and a half is that people that have gotten COVID are having some long-term effects. We're having people that are having memory issues, that are having fatigue, that are having problems breathing, that are having cardiac complications or clotting complications from the virus. And so it's more the worry of what is that virus going to do to you in the long term than what might happen from the vaccine.
It's really well said. There's more risk for long-term with contracting COVID and the virus than preparing and preventing with the vaccine. So thank you for that. This might be also someone might want to address the multi-system inflammatory syndrome. I know a couple of you had mentioned that, and that is something that does have some of our parents concerned if they contract COVID. Another great way to reason to get the vaccination to protect against that. Anyone want to further that, Dr. Goldis?
I can start with it. So the multi-system inflammatory syndrome, we are continuing to learn about. It's pretty scary because we don't quite understand who it's going to affect and how it's going to affect them. It presents similar to another syndrome we see uncommonly, but something called Kawasaki syndrome. And so the kids that we've seen present about 2 to 8 weeks after an known COVID infection or a possible exposure to COVID. There's not always a history of a known COVID infection, but they present with a large inflammatory reaction where we start to see fever, rash, abdominal pain, vomiting, diarrhea, overwhelming fatigue, And then we see that kind of progress further, and we see issues throughout their organ systems. And so in this last wave of numbers, high numbers of COVID this spring, unfortunately, we saw more children with the COVID infection than we had seen all the previous times. They represented about 24% of all COVID infections. And so we've really been closely monitoring over the past, 4 to 6 weeks to see those increasing numbers of that multisystem inflammatory syndrome. And so it's scary, and we're kind of all on our guard right now for watching for it.
Thank you for that clarification. This next question, I think, is for me. Says Dr. Siglarik, for those who choose not to have the vaccine for various reasons, whether it be religious, medical, or personal reasons, will there be a policy put in place that will speak to discrimination, bullying, shaming against non-vaccinated individuals? It's a really fair question, and I would answer it in a couple fronts. All of our schools have policies currently in place that address any forms of discrimination, bullying, shaming, or harassment, and those policies will remain in effect, especially if there are individuals that are being singled out. The second point to that is, as Dr. Meyerson said, at this point in time, the vaccination is not going to be required of individuals to attend school. Is that something that a school board might consider during, in the future? That's going to be really up to the individual school boards. And we still very much believe in our students' privacy rights. And so there really shouldn't be a mechanism where individual students know what the status of other students are, especially on the medical front. So I would like to think that there are a lot of safeguards in place to ensure the safety of our students on most fronts, but especially this one. And I'll just follow it up, and maybe our brilliant panel of experts might be able to weigh in too. We don't know precisely what next year is going to look like with respect to many of the policies and practices that we've had to put in place this year. But I could imagine and see where a school district might make masking, optional. And so we'll have students that maybe aren't vaccinated yet that will want to wear masks. And to the point of the person that asked the question, we'll want to make sure that everyone feels safe and has the ability to practice that if they so choose. So it's going to be interesting moving forward, but we're absolutely going to ensure that the student safety and security is of the utmost importance for our schools. I think that has cleared the deck for the questions. Maybe we just have a few minutes left. Maybe before we end, I would just give it to our panel of experts, maybe on some parting words as we go around. And if it's okay, I think I'll just start with Dr. Meyerson.
Wow. I think, the summary for me, I'm excited that we have, a vaccine that's very effective, it's very safe, and it can protect, that we can protect our children, 12 years and up. And, I wish we could have done this sooner. But I'm happy that it went through the proper channels, it went through the proper trials, and it's available now. And, we can protect our children. We can greatly reduce the risk of disease to them and those around them. It could be their parents or their siblings or their grandparents who are at high risk. It could be them. And it's also, going to greatly improve their ability to participate in summer activities, work, social gatherings, sports, school, all of those things. I think really, I hope everyone considers getting vaccinated as soon as possible. And we're going to be out there giving vaccines and offering them in different places and different sites, whether it's at your doctor's office or or at the health department or pop-up sites, pharmacies. The whole idea is to make the access there, to make it available, to make it easy. If you can't get it this week, there's next week. We're not going away. We're going to keep doing this, at least through the summer here. I don't see you're not going to lose your chance there. So, talk to your doctor if you have more questions. You can go to the health department. There's other reputable sites. We have them. The Munson has a great listing of materials and references for you. So, get your questions answered and really think about getting your child vaccinated.
Great, thanks. Dr. Nefsi?
Yeah, I would just say, I've had the opportunity to see two different surges in our community, and one was pre-vaccine and one was after vaccine. And what I can tell you is that while both surges were, tough on the hospital with the number of patients we had hospitalized and the number of deaths we saw and the number of very sick people we saw, the vast difference was in that second surge. The majority of the patients, the vast majority, there were fewer than a handful across the entire Munson system that got hospitalized that had been immunized. They were all unimmunized people. So the vaccines work. They work to keep you safe. They also work to keep the other members of the community safe. And we know that our children and other individuals can't get the vaccine for various reasons. So, that's kind of how that community immunity or herd immunity works, is we all get vaccinated to protect not only ourselves, but the vulnerable people around us. So it works. If you have questions that we didn't answer, thank you, Dr. Meyerson, for mentioning the Munson Healthcare website has a lot of information. The state has a lot of information. The CDC website has a lot of information. And you have a lot of physicians in this community that would be happy to sit down and talk to you about it. So if you don't have a primary care provider, you don't have a pediatrician you take your child to have that conversation, there's nurse advice lines. There's a lot of different ways you can get information to answer your questions about this vaccine. Please don't go to Facebook or other social media sources. Talk to somebody who actually has studied this and knows what they're talking about. Ask the questions that you need to ask, and then make the best decision that you can for your child and for the people around him or her.
Thank you. Dr. Galdas?
I just want to say, after really tough, 1.5 years dealing with this, we have the tools to start to fight back finally. And our kids need to get back to their regular, normal lives. I highly recommend the vaccine. We all highly recommend the vaccine. And if you have more questions, like Dr. Nefsi said, Dr. Meyerson said, reach out to a trusted medical professional or the resources that were named. I'd also like to say there's still a lot of people struggling with mental illness right now, whether that be adults or kids. And I think it's really important to reach out to your medical providers, pediatrician for kids, because you're not alone. And this has been hard. This has been really hard on a lot of people. And so we shouldn't be letting our guard down. COVID is still in our community. Our numbers are tracking down, but we can do our part to continue to help them go down. And so reach out, get your kids vaccinated, get yourself vaccinated. And if there's any further questions, talk to your doctor.
Great, thank you. And Dr. Klee?
Yeah, the whole question of the vaccine has been an emotionally charged topic. And so there's people that are very pro-vaccine, there's people that are very anti-vaccine. I think all of us have the well-being of our children in mind. And we got to remember that when we talk to each other in the community about the vaccination. But look, as Dr. Nefsi said, make sure where you get your data is from reputable places that you understand what's out there and the risk and benefits. And our panel feels very strongly about the risks of not being vaccinated are much, much higher than being vaccinated. And so we really encourage you to be vaccinated. The vaccines are now available in your family practice offices and your pediatricians, through the health department, a lot of different places, and a lot of the pharmacies as well. So make sure you don't just fall victim to the COVID vaccine or COVID fatigue, that is, and make your important decisions that you need for your family's health, as well as our community.
Great. Well, thank you so much. I feel honored to be in a community that has such brilliant professionals that are willing to give up their time to ensure the health and safety of our most vulnerable population, as well as our students, and trying to get their questions answered. So thank you all for your time and your expertise and your continued efforts to get more information out around the vaccine. So we will have this, this has been recorded, so we're gonna make sure that we get this out to our parents within our 5-county area, as well as we'll make sure that we post it on our site and give each of your offices a link to it so that you too can share it with your families. So with that, I just want to again thank you for your time and your expertise, panelists. And hopefully if parents still have questions, they will reach out. Have a great evening. Thank you.